Dr. Yaniv's professional medical journey began in 1995 when he was accepted to the medical reserves in the IDF. Throughout his medical career, in between his residency and fellowships at the Sheba Medical Center, Yale, and Mount Sinai, Dr. Yaniv assumed key positions as an Army doctor for special units. There he met a few key people in his life. 1, his wife, and 2, his future co-founders of ADOC. Having specialized in radiology, Dr. Yaniv was well aware of the rising challenges in the field, particularly the pressure to produce quality results at a faster pace. Today, Dr. Yaniv will be sharing with you the story behind ADOC. Dr. Yaniv credits his family as his greatest accomplishment, and he would never turn down a good slice of pizza. Talpiot XMed, leadership in healthcare.
Good evening. I'm a radiologist. Radiologists are those subspecialized doctors who are responsible of reading all medical imaging, including X-rays, CT, MRI, and more. One of the first fundamentals you learn as a resident is that a second view or a look can completely change the perspective on the case you are reading. This should lead me to the understanding that if every radiologist will have someone or something that will look over his shoulder while he is reading his studies, this will enhance his abilities. We can actually create super radiologists. Now, I would like to take you now to a real case, showing how important it is to have something looking over for you. 7:25 a.m., it's probably the most dangerous hour in the ER day cycle. The physicians and the radiologists are tired after another tough night shift. In the list of the radiologists, there are 8 more scans to read, and the radiologist will probably leave it to his colleague coming to replace him soon. At the same time, an unconscious patient who was suspected to suffer a seizure was having his head scanned. Let's call him Mr. X. At this situation, his scan will wait for at least an hour and a half before read by the radiologist. Now, before I will tell you what happened, let's go back in time to 2015. In the winter of 2015, I was sitting in my office back then at the Hebrew University, Jerusalem, when my cell phone rang, and on the other side was Elad Valach, a commander in an elite Air Force technological unit. Elad had a great idea. He said, let's create a joint research project between his unit and mine, thereby allowing our trainees to learn how to bridge ideas between the technological and medical world. Our idea was to create special 3D glasses for endovascular surgeons to aid them navigate in the blood vessels. That was actually the first time I realized the potential of synergy between medicine and technology. 2 good things happened due to this project. First one was first prize for best medical project, and second was meeting my amazing co-founders of future ADOC, Elad, Michael, and Guy. At August of 2016, ADOC was officially founded. Our vision was to create a life-saving AI for artificial intelligence system for radiologists' second look. So ADOC is actually an artificial intelligence solution that supports and enhances the impact of radiologists' diagnostic power, helping them expedite patient treatment and improve quality of care. In simple words, we create special algorithms that alert the radiologist about life-threatening pathologies. One of our first insights as we founded ADOC was that we need an alpha site, a strong medical base that through strategic partnership will help ADOC thrive. Sheba was the natural choice. The ARC Hub helped us achieve the most important 3 assets we needed to create a successful product: a bidirectional cooperation, real-life integration in a major hospital, and an ongoing feedback for our products. Now let's go back to Mr. X at the Sheba ER. Only 9 minutes after he was scanned, an alert by ADOC appeared on the screen, alerting the radiologist that there is a suspected brain bleed at the last head CT done. The radiologist opened the scan and looked at the alerts. Actually, they didn't look like bleeds, but rather another life-threatening pathology. This looked like clots within the brain arteries. This required a very urgent response. The radiologist stepped away and physically pushed the patient back into the scanner. The new scan showed the real pathology: blockage of numerous arteries in the brain. Now, these examples show two of the three main fundamental principles of our AI products: prioritization of urgent cases. The product should be always on, never needed to be manually operated, and always at the background checking the scans. But what about the first and most important one, improving patient outcome? Back to the patient. The patient was brought emergently for an angiography, and as you can see, the blood clots were removed, restoring blood flow to the brain. Unless ADOC alerts, the patient would have been waiting precious time before diagnosis and treatment. Instead, today, after short hospitalization and rehab, the patient actually went back to his life fully functional and with his family. April 1st was the first deployment of the brain bleed algorithm at Sheba Medical Center, our alpha site. And 6 days later, I actually got an email I will remember for a long time. The email was from Professor Hoffman, head of neuroradiology at Sheba, who wrote this email. While I'm reading old MRI cases, this ADOC thing popped up with a new intracranial hemorrhage at the ER. Looks really good. Today, 4 years after this ADOC thing, ADOC has gained 6 FDA and CE-approved algorithms, discovering time-sensitive, life-threatening pathologies covering almost all areas of the body. These algorithms were validated by numerous peer-reviewed abstracts and paper. Moreover, 96% of the radiologists who tried ADOC products have decided to continue using it. And now, ADOC products are deployed in more than 500 medical centers all over the world. However, as I mentioned before, the most important factor in the success of the company is about patient outcome. And these are just a few testimonials from all over the world showing how AI impacts radiologists and patient outcome. Thank you very much.
Talpiot XMed, leadership in healthcare.